I was training hard. My mind was working good. Uh, I was in college in the field of engineering and in research. So everything was going great, and nutritional supplementation was making a difference in my personal life. In the 1970s, I made a career change, became a doctor with a specialty in athletic rehabilitation, number one, and number two, the ability to use food-based and herbal medicine compounds in my clinical patients. And over the next 30 years, we literally saw miracles happen in people's lives. And at that time in the 70s, we didn't know why people that were ingesting nutritional supplements from food were having miraculous experiences. And being a curious person, I always was wondering, I'm happy, but why are they getting results? We did not know. Uh, in about the year 1988, 1990, science came out with a discovery, and they studied broccoli, a plant, and they discovered a compound in broccoli called sulforaphane. And it was a chemical in the plant, and they didn't have a category for this chemical from a research standpoint. And they knew many, many more of these plant-based chemicals were there. So they came up with the term phyto from plant and chemical for the constituents that was in plant. And this very first sulforaphane was a very, very powerful anti-cancer compound, the most powerful that they had seen to date. And that started a revolution in pharmaceutical medicine research, because what they were looking for is these magical phytochemicals in plants so that they could make drugs, patent those drugs, and make billions of dollars. And that started a revolution. And I've followed that research uh, pretty much every day of my life since that time. In the years 2000, I retired from clinical practice and began to do research on the thousands and thousands of patient files that had incredible results. People that had serious health challenges that medicine could not address began to change their health patterns by using supplementation. And so I tried to still understand, why is this happening? How could this be? So in the early 2000s, we began as a global project called the Human Genome Project. And scientists from every country in the world spent billions of dollars to unravel our genetic code. And part of that research spawned a concept called, and it says on the screen, epigenetics. And so I'm gonna, let's see if I can blow this up. Epigenetics was a term given about a new system involving our DNA. And so I want to talk a little bit about the science. The science is boring. It's exciting for some people like myself, but I want to give you a little background into the science and the why and how we developed, based on science, this incredible new wellness paradigm called Joegenics. So first, we're going to talk about the science of gene expression. And I'm going to go back to a diagram that was done by a professor, Mr. Wu. He happens to be at Rutgers University, a Chinese are probably Taiwanese, Chinese, brilliant scientists, and they began to really kind of put the picture together, and this was in the year 2011. And very quickly, all of us, as a human being, our bodies are made up of organ systems and tissue cell lines. And each and every one of our cells has chromosomes. And this is basic biology, probably everybody had and has forgotten. But these chromosomes, there are 46 chromosomes in the human body, 23 pairs that fit together, 23 from your mother, 23 from your father, and it is a combination, what we know now, of the complete DNA template that makes you uniquely who you are, from your eye color to your how quick your hair turns white or gray, and every expression of your life they found with this Human Genome Project was based on this DNA molecule. And that DNA molecule they discovered has information stored in it, and our DNA molecule contains 6 billion of these information packets wrapped around inside each and every cell. And their job, the DNA's job, is to make on demand information transfer so a protein can be made in the human body. For instance, right now, my body's going through millions to billions per second changes in my DNA. Some of it is very positive because I'm excited. I'm talking to friends from around the world, and that's changing how my DNA is expressing instantaneously through making messenger RNA, which makes a protein. And what we discovered in science about the 1900s is that carbohydrates, fats, and amino acids or proteins are the building blocks of this human that we are. And in 1988, in the field of metabolomics, we discovered these phytochemicals interact with this DNA to make these proteins switch on or off for the benefit of our health. Health comes from the expression of this DNA making this messenger RNA and making these proteins. And I know it's very complicated. This is fields of science called genomics, transcriptomics, and these are thousands and thousands of scientists with PhDs that have spent their life studying how this incredible mechanism works in our bodies. So we knew this, and I knew if this could be, I knew that nutrition had a big part in getting those sick patients well, had a big part in my life, those phytochemicals coming in and changing things. It began to give me an answer as to why this was important. So the next thing is gene expression. How does nutrients, how do things change our genes instantaneously? So this is another graphical representation of gene expression, how that DNA is being expressed, and they've got 3 major categories, how it's happening. But the amazing discovery 10 to 15 years ago was not only is your genetics, your age, your gender, and your ethnicity important, those are kind of locked in factors in your DNA. But what they discovered is that there is another whole system around the DNA molecules in our cells, our lifestyles change our DNA instantaneously. And things like the environment could either be good or bad. Diseases could affect us good or bad. Lifestyle and stress, medications that people take, toxins that we're exposed to. Those were all things that changed that DNA and either determine good health or the body going towards illness or disease. And so, what they finally discovered, again, with that discovery of phytochemicals, is that nutrition is one of the biggest impacts on controlling this gene expression. And in my experience, in my research, not only nutrition, but controlling all of these factors, especially physical activity. And the combination of nutrition and activity and controlling all these other factors allows us to live a long, healthy, disease-free life. So nutrition is an epigenetic modulation or activation or inhibition of cellular enzymes, literally a switch for gene expression. And I know it's complicated, and this is the first look. We will be educating about this for the next period of time to explain why Joegenics came to be, but more importantly, how it's impacting your life and the life of your loved ones. So we know that there are things that support and control epigenetics. And as Reymee said, I've known Reymee for over 10 years, and he's heard me talk about forever this story about phytochemicals, because these have been discovered to be the major regulators of that gene expression. For instance, we have genes that are called oncogenes. If they are turned on, your body has a much more high probability of getting cancer. If they're turned off, those genes will not express cancer and you will never get it. Those are controlled by phytochemicals. And most of this phytochemical research was done by the pharmaceutical industry for the purpose of discovering a new plant compound that could be altered, patented, and made into a drug for the treatment of every known disease, including cancer. The beautiful news is we don't need to spend $1 billion and 10 years of research. Nature has already put together these phytochemicals in the form of plants. And the problem is we're not getting those in adequate quantities and adequate quality in our lives so that we can be healthy. And I want to show you the real problem. And it's not only a problem now in the United States, but it's a problem now creeping around the world. Science says 8 out of 10 Americans don't eat enough color in terms of plants: red, purple, green, white, and yellow. And these plant compounds contain thousands of regulatory phytochemicals that change the expression of our lives. And if you look here in America, and this is my country, we've got vast wellness, vast research. And if you look, just eating the red plant spectrum, 74% of Americans are not getting enough of those. 76% of not getting enough purple colored plants in their diet. Green, 69%, 83% the white, which is cauliflower, garlic, onions, mushrooms, and 80% uh, let me back up. I hit the wrong button. 80% not getting enough yellow. And we knew this was a problem all the way back into the 1970s. And that's why I began personally to use nutritional supplementation, but also using it on our patients. This is why we began to see amazing results, is because we were supplying the body with the missing phytochemicals. And adding to this global problem, these fruits and vegetables are now being produced in poor soil conditions that has now rendered the soil absent of vital minerals and vital nutrients that supply the plant so the plant can develop correctly. So we knew from our research and engineering back in the 70s that by the year 2000, every person on the planet would need some form of nutritional supplementation in order to make their lives healthier, to avoid and prevent catastrophic health challenges. So we developed, starting back in the early 2000s, I began to work with my mentors, pharmaceutical research scientists, developing products. And Reymee has taken some of those products. Some of you that have been involved with us for years have taken those products and have seen literally miracles happen in the people literally around the world. This technology is the latest based upon this global understanding of epigenetics and gene expression. So Joegenics represents kind of the latest in science and technology to solve this global solution. And it comes with decades of research. Some of that I've been able to do myself, thousands and thousands of human clinical studies, and we've continued that up till exactly right now. To give you an example, one single ingredient in Joegenics has got over 10,000 scientific studies showing its validity and how it works and how it changes that gene expression instantaneously. So, as Reymee alluded to, we've made products in the past with up to 10 different phytochemical based plant species. Joegenics has got over 20 scientifically studied ingredients that fit together synergistically to give as much scientific support as we know how to the human body by ingesting the ingredients in Joegenics. Also, Joegenics will provide the body with thousands of phytochemicals from all those different plant species. And that's critically important because the phytochemicals in broccoli plus the phytochemicals in an apple or a blueberry work synergistically to change that gene expression. And our research is about how to mix those together and get the maximum effectiveness and efficiency out of a product. So what are the benefits? Well, Joegenics, as you will see once you get it, is easy and enjoyable to consume. And this is kind of the latest technology. We used to use a lot of liquid nutrition because it would go into the mouth and cause a change immediately into that gene expression. This is in a powder form that goes into the mouth, bathes the oral cavity, sending signals to the brain to immediately begin to work in terms of gene expression. So it's easy to do, actually tastes very good, and it's going to make it available for a lot of people to not take capsules and pills or to have to use a bulky liquid. This can be anywhere on-demand nutrition. Uh, it affects multiple body systems. And our goal and ultimate wellness is not only to affect things that maybe make your eyes see better, or your taste buds taste better, or your energy levels to improve. We want to affect hundreds to thousands of biochemical systems so that your body has the optimum opportunity to be well. And so Joegenics supports hundreds of cellular systems, incredibly complex systems that are operating billions of times per second. It's mind-boggling that we now know how to actually have control over these cellular systems. It's synergistic with some of the other technologies like the proteoglycan technologies. And I've had the opportunity to spend hours in understanding this research and this technology. And we wanted to create something that works with things that were already going on with Thanks I. It has a positive effect on brain function, which is critically important. The brain is the target of a lot of nutritional science because most people, as they age, their memory is not as sharp, their attention and their ability to not be distracted changes with age. And I can tell you, after 50 years of nutritional supplementation and exercise and taking care of my health, that my mind is still sharp in my 70s. I'm approaching mid 70s at this point, and I can tell you I haven't changed much in terms of brain function, which downstream allows the whole body to be affected. So a big part of how Joegenics works is on getting that brain working appropriately so that we can be functional in our lives every day. And we have stresses in our lives on an everyday basis. Environmental toxins, medications that we take, exposed to all kinds of environmental insults. And that causes the DNA to switch from health to ill health. And Joegenics has the ability to change that stress response, physical stress, emotional stress, or environmental stress. All of those stresses cause either positive health or negative health. And Joegenics turns those switches on to decrease this stress response so that we can be the best of who we can be. So what are the benefits when you take Joegenics? Well, what does it do? And we will be asked that question multiple times. And the simple answer is Joegenics provides raw materials in the form of these phytochemicals, scientifically studied, put together correctly, so that the body can restore itself. If we have ill health, if we have the ability for our immune system to be weakened, our bodies are in a state of needing genetic change so that we can go from ill health, restoring it so that our bodies can optimize that health, so that you can be like me, age 70, I still, even in the coronavirus world, am able to work out 6 to 10 hours a week so that I can maintain my health at the highest level, optimizing it with the use of a product like Joegenics. It's an easy strategy for me to maintain getting my health in optimal condition, providing that body with these phytochemicals that are so desperately needed. And it does this through epigenetic control of gene expression. that's kind of the background and the science that I wanted to talk about. I know it's complicated. We make it very simple. Take Joegenics, use it on an everyday basis. You will see your health begin to improve, go to optimize, and you literally can maintain it. And our goal at Thanks I, and what a phenomenal opportunity we have being with this company, they're committed to not only make Joegenics, but to continue the research. And as the research changes, we will always make positive changes to Joegenics so that you, your families, and your distributors are able to use a product, and it's the foundation of a phenomenal business opportunity. So I want to thank you very much, and I know Reymee, we're probably going to do now some Q&A. I think that's in order. Uh, so I will kind of get out of this full screen shot here and go back to me if I knew how to do that. So I'm going to
just stop sharing up there, right at the top.
stop sharing.
Yeah.
You are sharing. Stop share.
Yay! You got that right.
Wow. Yeah. Awesome. Awesome. Thank
Yeah.
you.
So I think Mr. Kaneko-san said that we're going to do some Q&A. I'll be glad to answer questions, and this is kind of my favorite part because we have an opportunity to hear what's on your mind and to answer questions where, number one, the company is protected because these are dietary supplements and there are laws in every country. So I will use the language so that we are safe and we protect our incredible technology for the future.
Okay. Thank you. Thank you, Dr. Joe.
Yes.
Before we go further, sorry guys, we have full pack our Zoom call. So about 30 people coming in, coming out, coming in. We're not expecting this. Well, thank you for the support. We have 12 country for all over around the world. We have Australia, Hong Kong, Macau, Thailand, Malaysia, Indonesia, Brunei, India, Kenya, Norway. Oh my God, it's very full. So yeah, as I say, you might have typed some questions in the chat box, or maybe you have another one to be asked. Just want to remember you guys that for male participant, you can oh, I'm sorry, you can hello. Too excited. So for male participant, you can privately use the chat box, send privately to my wonderful co-host, Mr. Alan Tam. And for the female participants, you can send privately to Miss Myra. They gonna filter some questions because the next one we're gonna have the Q&A, but before we do the Q&A, I want to invite a special person to help us become the moderator, and he will give around 10 general frequently asked questions to Dr. Joe. Then after that, the co-host will filter some of your questions. So I want to welcome the one and only 35 years experience in network marketing, legend, mentor, business coach, and who else? Please, warm applause for Mr. Nobuhiro Kaneko.
Well, thank you very, very much, Yosef, for the nice introduction. And hello, everybody, or good morning, good afternoon, good evening, everybody from all over the world. Okay, I've been working together with Dr. Joe like 13 years already. And then, you know, there are all kind of the doctors in the world. The money, always going after money, or the doctors going after the money, or the doctors who really care for the people? Definitely, Dr. Joe is the person they are working for their people in the world. So that's why I'm very, very happy to introduce Dr. Joe here today to everybody here. And also, I'm so confident with this company, Thanks I, because of their Dr. Joe. You know, as far as he's producing the products for us, this company will definitely be safe. Okay, let me ask Dr. Joe the general questions which we oftentimes being asked. Okay, number one is in short, what are the features of the Joegenics in a short way?
Yeah, in a short way, Joegenics is a simple strategy that you can take, and I keep it at my desk. You have a packet. See, a packet, Joegenics. You simply take it, put it in your mouth, and let it dissolve, and your body is now being flooded with thousands of phytochemicals. And what they're going to do is change your ability to have more energy, to have a better brain function. You're going to be able to sleep better, and everything that's going on in your life will shift from ill health to better health, simply put.
Okay, okay. Next question is everybody asks, when is the best time to take the Joegenics? Let's say if they take one time, when? If they take 2 times, when?
Well, generally, across the board, science says when you're going to take a phytochemical product, it's best to take it on an empty stomach. And so, very easily, first thing in the morning, on an empty stomach, you can take Joegenics. If you choose to take it multiple times a day, and the people that need restoration of health may need more than one until they get to optimum health. Then in the afternoon or the evening before bed, still on an empty stomach, Joegenics is best taken.
Okay, okay. Next question is how shall we take the Joegenics? Straight into the mouth, or can we take it with put it into the water and then mix it, or?
Yes, you can do it either way. I prefer the dry powder in my mouth because it will then become a liquid, and that liquid in the mouth is instantly coating into the brain all of these phytochemicals that are coming in, and the body sets itself up for utilizing Joegenics in the most optimum way. Can you use it in water? In it, absolutely yes. Or in some other beverage you could use it in. Most effective, I believe, Kaneko-san, is using it dry in the mouth and letting it stay in there and dissolve and swallow it. It's excellent.
Okay, okay. And also, some Chinese ladies ask, can we take it with the hot water?
Yes, not a problem at all. Can be made as a beverage like a tea. And that's an excellent way because we're sipping it throughout drinking the tea. No problem.
Okay, okay. And then how many sachet we can take per day? Like some people want to be super healthy, and then they want to take their 10, 20 sachet a day.
Right. Well, science says, and I learned this probably 10 years ago in the scientific literature, the question was asked, how many phytochemicals do we need? And the scientific answer by scientists at the National Institute of Health here in the United States said, we don't think you can get enough phytochemicals.
Oh.
So in the United States, they're recommending 13 servings of fruits and vegetables to try to get what's in one packet of these. So the goal is to get as many phytochemicals in your body as possible. So the less health that you have, the more you're probably going to use Zoegenics until you get to that point where you're super healthy. I can get by literally with one of these per day. However, we have something going on in our environment called COVID-19, and our immune system as high function as possible, so I use more. And so I tell people, use as much as you can afford for the first 4 months so that your body gets as much opportunity to get that genetic control as best as possible.
Okay, so there is no limitation you can take per day.
Exactly. There's no toxic buildup at all.
Oh, okay. Very good, very good. Okay, and also, are there anybody that their food should not take their Zoegenics? Certain kind of their sickness or?
Right. It is a dietary supplement, and around the world, most of the governments say if you're going to take a dietary supplement and you're under the treatment of a doctor, at least let the doctor know what you're doing. This is all natural material from food-based compounds. There's no drugs, there's nothing artificial. So most of the doctors that understand that, and I work with oncologists with people being treated for cancer, and they recommend as much of this as people can get, even undergoing chemotherapy and radiation for their health benefit.
So, how about the
go ahead.
How about the children? Children still can take it?
Yeah, the children obviously need the ingredients here because they're not eating all those vegetables. So the goal is utilize it, make a personal decision if you're a parent to utilize it into your children. As a company, we say children under the age of 6, consult with a pediatrician and let them know this is food, this is food-based compounds, and most of the pediatricians I've talked to over decades have said, wow, that's incredible. They need more of it, not less of it.
Okay. And then the how about the in general, how long will it take to feel the difference?
Wow, that's a great question. We know based on a science that we have what's called biochemical individuality. And that was discovered where I went to school at the University of Texas in the year 1955. Each one of us, his chemistry is as different as our fingerprint. So everybody's going to respond differently. And here's what I expect to see. A percentage of people are going to take Zoegenics for the first time, and they're going to go, wow, this is incredible. Incredible. Because it's in the mouth, and it's causing that gene expression, and for them, uniquely, it turned on systems, and they feel it, and they recognize it. Other people, it may take a week. Here's what we know scientifically from my human clinical research, that our red blood cells in our body, the billions of those, none of those will be alive in your body 4 months from now. They will all be replaced. And if you bathe your environment with Zoegenics for a 4-month period, you're going to have a massive change in how your red blood cells deliver oxygen and nutrients to every tissue in your body. And so I say some people are going to get an immediate response. Some people it's going to take longer. But at 4 months, 90% of the people are going to see a very positive change from the application of Zoegenics.
Well, Dr. Dia, you were saying before that like 15% of the people will feel the difference very quickly. 30 to 40% of the people 1 to 2 weeks, something like that.
Correct. Correct.
And then most of the people will feel something positive within a month.
Within 30 days, yes.
Within 30, yeah. Okay, okay. And then I remember that you told me the problem is that we don't know who can feel the difference and how long will it take.
Exactly.
Correct.
That's still the mystery of science. And maybe one day, hopefully in my lifetime, we will know exactly who's going to respond based on their genetic profile. That research is being done today, but it may be 5 years before we know the answer.
Okay, and also we've been told before that the capsule tablet, but the drinks is much better to get the higher percentage of the absorption. But how about the bioavailability compared to the drink supplement to the Zoogenics?
Yeah, it's very similar, but when the dry powder, without it ever being exposed to moisture, it's in its maximum strength. And so I like to take it, and even if you make a tea out of it or put it in a beverage, I like to put it in my mouth, dry powder, and let it dissolve because it's activating sensors in our brain immediately. So that's kind of the best strategy to use it. And that means Zoogenics, every time you use it, is as fresh as it possibly can be.
Okay, okay. Okay, and also, what kind of their testimonials do you expect first when the people started to take it?
Yeah, you know, again, that's one of those things that's everybody's different, but I can say across the board, people are going to feel, they're going to feel better in their brain. They're going to all of a sudden, man, something's different. I'm thinking better. I'm more focused on what I'm able to do. My energy levels are better. The aches and pains that we have, especially people that are baby boomers, people over 60 with aches and pains, they're going to all of a sudden go, wow, that arthritic hand does not hurt as much as it used to. The wrinkling of my skin is changing. Maybe I'm looking younger. Those are the things I expect to see. And then with continued use, we're going to see people that have severe health challenges. Some of those are going to change and it's going to look like miracles. And we don't have the total answer to that, but we know that's going to happen. And I can't wait hearing from around the world the miracles that take place in people's lives, because that's why we develop Zoogenics. Not only to support a great business opportunity, but to be part of a revolution that changes the health of the world.
Okay, the last question is what shall we do in this pandemic period to protect ourselves?
Yeah, that's a great question, and that question's being asked all over the world. I'm in Texas, and right now we're having an explosion of reinfection of COVID-19. And as the science say, COVID-19, if you have a strong immune system and you're getting sunshine every day or supplementing with vitamin D, those are massive deterrents for your system getting COVID-19 or getting it and not even know you have it. And that's where most of the people will be. So Zoogenics is not a treatment for COVID-19, but it is a genetic supplement for empowering the immune system to attack viruses and bacteria and parasites. We know that these ingredients do that. So I believe that's the strongest thing you can do in this crazy environment we're in is use Zoogenics daily and even multiple times a day to impact that immune system health so that we're strong, we're healthy, and we are immune to some of these crazy things going on in our environment.
Yes, okay. Okay, so those are the general questions. Let me pass it over to Alan and also Myra. If you are getting the questions from the audience.
Yep, there's a lot of questions actually.
Wow.
But some of them actually, Dr. Joe has actually gone through, like the bioavailability compared to liquid. There is one interesting one, which is, has there anyone been who has COVID-19 has tried Zogenex and any outcome?
Yeah, well, that's a great question, and I don't really have the answer because Zogenix is new. It hasn't been out since the COVID-19 began. We've had a few people around the world use the product, so we don't know. But my suspicion is that we're going to see the population of people in Thanks Eye taking Zogenix. A year from now, many of their friends will have been exposed to COVID-19 as they have been. They didn't get it, and their friends not taking this may have. And that's strictly because this supports the immune response. So, no, we haven't seen those results yet, but I'm very curious to see how that's going to happen, right?
Yeah, yeah. Okay.
Hey, Alan.
Yeah.
By the way, I don't know how many members all over the world for the Thanks Eye today, but I never heard anybody Thanks Eye members ever get the COVID-19.
Yeah, that's one thing. Also, another question that I have here is at what age is suitable to consume it? At what age means basically from babies all the way until any a very advanced age.
Yeah,
Is it safe for them?
with the babies, here's what I say. The best way to feed a newborn infant is through breastfeeding. Okay? If the mother's taking Zogenix, she's going to pass that Zogenix through her breast milk to her baby. And that's the best strategy for a newborn. The laws around say be careful recommending products like this to children unless you consult with their doctor. But anybody, any age, should be able to use food-based food compounds to impact their health. No problem.
Okay, and which means for pregnant women it's also suitable.
Say it again, Joseph.
For pregnant women, it's also suitable for pregnant women.
All dietary supplements have on the package not to be used for pregnant and lactating women. And the reason is there's a lot of synthetic vitamins and mineral compounds on the market. And science knows those are dangerous for a developing baby. So this is natural. We don't recommend it for pregnant lactating women, but if they choose to take it, it's all natural and has no downside. But as a company, we need to be very careful about what we say in terms of recommendations. That's always a personal choice.
Okay, thank you. Another question is what kind of people with certain allergies should not take Zogenex?
With certain allergies,
Yeah. Is there
yeah,
any particular allergies?
yeah, food allergies and botanical allergies are very, very rare. Okay, but if somebody has a diagnosed allergy to one of the ingredients, I would say try the product. If you have a reaction to it, you need to work with your doctor because here's been my experience with patients. They come to me and say, "Oh, Dr. Joe, I know you want to give me a supplement, but I'm allergic to onions. I can't take anything with onions." But in extract form, we found if we introduce that product slowly, over time, their body and immune system builds up and they don't have that allergy anymore. That's building the immune system. So if they have an allergy to an ingredient, they have to start slow. But any other allergic situations going on, this should improve their response because their immune system is going to be enhanced.
Okay. I already have a lot of questions here, so I'm filtering them as much as possible.
Oh, you're doing a
Another
great job.
question, another question is about cancer. So, like if someone has cancer, is it okay for them to take this as part of to boost their nutrition level? Okay, and also is it how can it be used towards for them as a cancer patient as well?
Yeah, and that's a great question. Again, we need to be very careful. Geogenics was not designed as a treatment cure for any disease. It's designed to support the system to build our health so that if we have a disease, the body's beginning to manage it. I work with cancer treatment patients and the oncologists that are treating with chemotherapy. And I've got a friend that finished his 12th last chemo treatment yesterday. And the oncologist, I talked to him personally. Do everything you can to build your health while you're undergoing cancer treatment. And most of the modern educated oncologists know these phytochemicals are a tool to be used in the treatment of cancer. We don't recommend it as a treatment, but as a support mechanism when people are undergoing not only cancer, but heart disease, diabetes, brain disorders like Alzheimer's and Parkinson's. They're not treatment. Geogenics is not a treatment, it's a support so the body can heal itself.
Okay, thanks for the Parkinson's remark because that was one of the questions as well.
Yeah.
Okay, another question is if we take Geogenics, okay, can we not eat any vegetables?
Can we not eat any vegetables? That's a problem because, and people say, well, if I take Geogenics, do I still have to exercise? Do I still have to quit smoking? Do I still have to get out of a toxic environment? And the answer is yes. We want to do everything that supports our health. And so eating those 13 different fruits and vegetables every day. And I know I've traveled to Indonesia and I've been in Malaysia, and in my hotels, they have hundreds of different choices of great foods at a buffet breakfast. And we need to be eating still as many of those as possible. And I know in America, most people don't like to consume vegetables. And so Geogenics is a great tool, but I still recommend do all the things that support your health so that we can live to be 70, 80, even 90 and be in a high level of health.
Okay. Another question is Geogenics is 100% plant-based, right? No.
100% plant-based, nothing animal, and nothing synthetic.
Okay, that
All
answers three questions. Okay.
It's the, let's say this, it's the ultimate vegan product.
Awesome. Okay. What about people with injury to muscles and recovery for energy boost, like for athletes? Okay. Their question is tying in back to what Thanks Eyes other products, such as how is it different from Profil and Joyfil?
Yeah, well, again, we've got products at Thanks Eye that are mineral based and proteoglycan. That's another technology. Geogenics works synergistic with those. And I'm a training performing athlete in my mid 70s. Okay. And I can tell you, if I train hard for 2 hours and I don't take my nutritional supplementation, the next day I have soreness and pain and discomfort. And these phytochemicals allow me to train hard, recover faster, and my body's healthier as a result of it. So for training people, this is a tremendous, tremendous tool.
Okay, and last question I have from my side here is how is Yogenex phytonutrients different from other or better than other phytonutrient products out there?
Yeah, well, uh, there's a couple of reasons. Number one, we know where these raw materials come from. They've been sourced from the best extraction suppliers from around the world. And I've spent my life, for me, to find those extraction companies that make the very best raw material. So, number one, we get the very best raw materials. Number two, uh, the delivery system allows it to go into the body in its very freshest state. This dry powder has got a shelf life for years, and it's always fresh on demand. So that sets us apart from most of the other nutritional supplements in the world. Very fresh every time you take it. It's like having fresh food, organically grown, ingested every time you take it.
Okay, that's about it from my side here. So I'll pass it on to Myra if there's any from the lady side. Okay.
Yeah,
It's all right.
I have a question here. So from Hui Ching. So the question is, can kidney dialysis patient take this? And is taking Zogenex good for blood sugar level, especially for diabetes and Parkinson patient?
Yeah. Well, with any disease process, uh, and when we have kidney disease, at extreme ends, the patient needs dialysis. They have to literally take their blood out and clean it and put it back in. Most of those kidney doctors I've worked with have said when they're not on getting dialysis treatment, when they're eating their regular food, supplementation is critically important. Why? Because it helps not only the blood delivery system, but it helps detoxify some of the poisonous chemicals, and it supports the kidneys function so that they function better, even if a patient is severely ill as a dialysis patient. Now, I always recommend if they're on dialysis, check with the doctor to make sure that this is okay, because it's that doctor's patient, not ours. We're not treating people, we're supporting health, optimal health. So for any process, Parkinson's, Alzheimer's, diabetes, heart disease, any disease process is supported by Zogenix, helping the body to regulate those biochemical abnormalities that cause that disease in the first place. I hope that answers that.
All right, I think okay. How much recommend for kidney patient and diabetes? I mean,
Yeah, we don't know this. We don't use dosages because, again, this is a wellness product. And what I would say, the more ill a person is early on, the more Zogenix they're going to need to utilize. How much? Scientifically, we really don't know. I've seen patients that are severely ill
1 or 2.
with very little input get massive change. And then a very similar person took way more to get the same response. And that's that chemical individuality that we all have. So there is no, you just what we say is have to try it. And if it's not working for you, you may want to use more for at least a 30-day period to see if your body is going to respond.
All right, I think there's no more question for my side. Thank you, Dr. Joe.
Thank you very, very much.
Yeah, I have one additional question here. Okay, because supplements tend to be expensive, expensive people are taking supplements already. So if we are taking Jogenex, do we stop other type of supplements?
Yeah, well, this is not the total package of nutrition that we need. I wish we could get it all in one packet. But for instance, with the COVID challenges that we have around the world, we've known scientifically for over 10 years that the inclusion of vitamin D as little as 50 micrograms, 400 international units daily, boosts the immune system to where you almost will not get COVID-19. Now, with the incorporation of vitamin D in a product like Jogenex, you can get a tremendous amount of nutrition without having to take many other products. But we don't have an adequate amount of vitamin D, so I still recommend people, especially now that COVID's on the world scene, to take vitamin D every day or get 15 minutes out in the sun, sunlight into your eyes every day. Critically important. So Jogenex goes a long way of feeding the body all of those missing phytochemicals, but it's not all that we need. We still need maybe more mineral input, more, if you're a non-vegetarian, animal input like proteoglycan, because those are tremendous tools to support our health. So this will replace many supplements, but not everything.
Dr. Joe, I got one question here. Okay, okay, the last one question. So, question from Fazin from India. So, her dad is suffer from paralyzed stroke, and her cousin is suffering from pulmonary embolism. So, they have a Jogenex, and is any benefit expected in their condition?
Yeah, absolutely, because those conditions are what we call endothelial, the lining of the blood vessels in the system problem. And clots are forming. Jogenex was designed to support the blood delivery system, and it works through a process called nitric oxide production. And we've known scientifically this is a tremendous tool for helping people with those disorders. So we've incorporated ingredients in Jogenex that support that blood system. So it should be a great tool to support those people, not a treatment, but a tool to help their bodies heal itself so that those conditions are improved.
All right. Thank you, Dr. Joe.
Thank you very much.
Okay, I think.
Okay, just one more.
Okay.
I've been told different supplements working with different purpose for our body. Is Jogenex functioning to cover all general needs?
Yeah, that's a great question. And I would say yes, all general needs, but there are some that are very specific. And my example is vitamin D. Jogenex does not contain enough vitamin D to keep us supported. So generally, it's going to do a great job. Will it work better with vitamin D? Absolutely yes. Will it work better with exercise? Absolutely yes. So health and wellness, this is part of the tools that we recommend, but getting the whole body and that whole lifestyle working towards better health is the real true answer. And that's why we're all at Thanks Eye, because this company promotes health and wellness from all areas, not just the supplements. And that will be part of my teaching for the next 10 years.
Okay. Is there any specific medical condition where we need to avoid the product?
I don't know of any, but again, if you've got serious health challenges, we always want to work in conjunction with the doctors, because there may be some reason this doctor knows there's some ingredient in here that would not be good for that particular patient at that particular time. And that's, again, we just don't know all the answers. But generally, that's going to be rare, not common.
And does Joe works for animals like dogs and cats?
We haven't done a lot of studies on that, but there's been a lot of studies on phytochemicals on dogs and cats and horses and cows. And the answer is it would be a expensive solution for them, but if they're not getting a good diet, just like any human, they need that support. And there are many veterinary type products, and I've actually worked with developing some for the veterinary industry, so dogs and cats can be healthier. And with our products in the past, many people have used them because they love their pets almost more than their children, and their pets have responded very positively. I would expect that to be the case with Joegenics also, but we don't, again, recommend it for that reason, but people are going to use it, and I expect positive benefits for those wonderful pets that we all have and love.
Wow, there's another question again. For some patients taking medicine, how do they take Joegenics, and how long does it take? How long time to make? I don't really understand this. Okay. Do we take it together or separately?
Yeah, again, Joegenics is best taken on an empty stomach. So if they're taking medication, I always recommend take Joegenics on an empty stomach. It will be in and gone into the system within 20 minutes. And then an hour, 2 hours later, get on your regular medication regime. But try to keep them apart, because we don't want the medication to interfere with Joegenics or Joegenics to interfere with the medication. They work differently in the system, and that's why we recommend taking them separate, different times of the day, at least 2 hours difference in time. Joegenics on an empty stomach.
Okay, that's about it. Thank you very much, Joe.
Hi, Dr. Joe. I got two more last question for you.
Well,
Is it all right for you?
Last
okay.
two questions. Last two questions.
Yeah. All right. For active athletes, how many should they take a day for performance and recovery? A question from Amy.
Yeah, Amy, I wish I knew the complete answer. If you're already very healthy, I would start with one a day. That's kind of when you're healthy. For maintenance, one a day should do a phenomenal job, should really impact our health. If we have health challenges, we need more. How much more, we really don't know. But I've had people take up to 5 packets a day with severe health challenges with no problem, and hopefully that's inundating their system so that they get healthier and they need less as they go. So that's as best we know from a scientific standpoint. 1 year from now, after thousands of people have taken Joegenics all over the world, we'll have more information to know, wow, this is maybe now how we recommend it even better.
All right, the last question is supplement product selling here in Malaysia is too expensive. So we need all them as for our body and health. Do we stop all other supplement when consume Geogenics?
Yeah, it's not necessary to stop it all, but I would say if you're taking any other phytochemical based supplements, Zoogenics will replace just about all of those in the world because it's a phytochemical base. If you're taking vitamin D, you still need to take vitamin D. If you're taking other supplements for a specific reason for your health, Geogenics is going to complement that very well. After 30 days, you may be seeing your health improve. The first thing I would say is begin to eliminate those other supplementations, save the money, and use more Geogenics, possibly. Uh, that's been my experience clinically.
Thank you, Dr. Joe.
Yeah, thank you. Thank you. Thanks all the distributors around the world for the incredible questions because our goal is creating products that allow you to be healthier. If you get healthier taking Geogenics, you're going to be excited. And if you're excited, you're going to share this product with many, many people. And my goal is to see many people around the world super, super healthy, creating better health, and also impacting their financial position. Because what we know around the world, people are suffering from lack of money, and that's a stress. And if we can help people have better health and better finances, there's no better job we could do to serve humanity than helping in those two areas. So thank you all for being here. It's my honor to serve you, and I will do that for as long as I possibly can.
Thank you, Dr.
Thank you.
Joe. Thank you
You're
for
very
amazing
welcome.
insight of Geogene X. So the last questions is good from Myra's side. Uh, I think share with 6 people will be the answer for it. Yeah, and of course, there's some people here already proud with their Geogene X because I see Amy and yeah, that's one. Mr. Reymee there. But India, I think, have one. But for all of you who want to get how to get the Geogene X, it's very easy. Get to the person that invite you to the session and how you get this amazing product. And of course, uh, do the business, share with people about this great, amazing product. And for those in NFR countries, very lucky because you can order Geogene X, right? Well, I have to ask my dear friend Mr. Gobi to send me. Okay, I want to thank you again, Dr. Joe. Thank you, Mr. Kaniko. Thank you, Mr. Reymee. Thank you for all the speakers. Also, I want to thank you for my great co-host, Mr. Alan, Mr. Gobi, and Miss Myra, and one other person, I think, Miss Jennifer. Thank you for some translation in the chat box for Mandarin language. Thank you for the highlights. And before we close this session, I just want to inform this session is recorded, and the person who invited you or the leaders will give you the link and you can watch the replay. And I'm sorry again, it was out of our expectation, full pack, 100 people. I think I count at least 40 people cannot go through to the session. We're gonna upgrade to 200, and just like we said previous week, it's getting more bigger and bigger because all the teamwork or the great leaders are working very hard to build as a team. And we have lots of events coming up, not just just tonight's session, but every week. And okay, before I want to share you something and update some info about our upcoming event. Can you guys see my screen? Yeah. Okay. So for those of you who are new to this session, can you raise your hand? Maybe you are new person get invited from your friend colleagues. Anybody new here? Yeah, I see some people are new faces from all over the world. Tonight's session we didn't have the optional part of this great platform called Thanks I, and there's another optional part which is for me it's the best part. It's a business. It's how to do the business. And don't worry, we're gonna have a wonderful session called LTE, Learn to Earn, how you earn from this great, amazing business. So, held in on Sunday, July 19th, on Sunday. And you can, ask your inviter how to get the link. And also on the next Wednesday, we have another awesome tweet on July 22nd. We're gonna have every week this amazing tweet session. You can bring, invite or your loved ones, your friends, colleagues, and of course, in order for you to get your business start moving. The offer is we do the talk, you earn the money, right? It's a great deal. Yeah. So don't forget LTE and tweet. And then we have another product session called, this is a new event actually in July, because I've noticed there's a part of Zoom product session held by the Thanks I Malaysia office, but because some of us miss some of the sessions, so we managed to have new sessions called Prologue Product Catalog. It's on the next Thursday, after the day after tweet, July 23rd. So again, you must ask your inviter to get this link. It's gonna be a great session to learn the prominent side of Profile, our flagship product, back to back with Jojin X, right? And then the last one is on the next TGIF Friday. We're gonna have, wow, the one and only. Yeah, one and only. We're gonna have special night, day 1 to 1 day with the legend, Crown Diamond, Mr. Kaniko-san. He will share with us how his amazing journey in this business, how he impact people all over the world, including people on the screen and myself, right? So it's really gonna be exciting upcoming event, exciting week after week until end of July. And this is the chance for us to get to start right away, get to the person that invite you to this session, how you start this business, and get the products you love, and yeah, let's build and let's impact the world with positive energy in Thanks I community, because the world need it. The world need it now. Okay. And so that's it from me and the co-hosts and all the speakers. Thank you again for joining us with wonderful Friday sessions. We're gonna miss you guys just for a few days. We're gonna meet at the latest is on LTE, the Learn to Earn. Okay. Thank you all for coming. Thank you all thank you from United States, Dr. Joe. Thank you again.
Thank you
Yeah.
so much.
And
Thank you
keep
so
healthy.
much.
Thank you from Australia. Thank you Hong Kong. Thank you
Thank
Macau.
you,
Thank you Singapore. Thank you Thailand. Thank you Malaysia. Thank
South
you my hometown
Africa.
Indonesia. Thank you Brunei. Thank you India. Thank you South Africa. Thank you Kenya. Thank you Europe. And thank you everybody around the world. Thank you.
Thank you.
Stay
Bye.
Thank you.
safe.
Thank you.
Bye.
Bye.
Bye-bye.
See you again.
Thank you.
Have a
Bye.
great weekend.
See you again. Bye
Thank you,
bye.
Jennifer. See you again, Jennifer.
Bye bye.
Bye
Firdaus,
bye. See you next
your
time.
idol.
Everyone.
All right. Thanks, everyone.
Thank you.
Thank you. Thank you.
Joseph, you need the enterprise edition.
I will upgrade definitely.
Can go
Oh
up
my
to
god.
enterprise.
Yeah.
Enterprise can go up to
500.
500. Yeah, we go for 500, you know? It's a good thing. It's a good thing. It's
It's a good problem to have.
it's a good problem, you know? It's a happy problem. Happy problem. Yeah. Oh my
So
god.
you could see many people could not get in.
Yeah, I count about 43 people cannot log in.
Oh,
43
wow.
people.
Wow, okay.
Yeah.
Oh, well.
Yosef would have become a diamond.
Wow, thank you.
Oh
Soon.
my goodness.